नहीं नहीं, इसका हमेशा का रहता है, वो लास्ट मिनट बेचता है वो। हाँ, उसको मेल बोल डालने के लिए।
लीव मीटिंग साइन इन
हाँ ठीक है,
तो साइन इन अगेन
चैट पे रह रहा है।
My name is here, man. And then the print is so small. Recharging what?
Yes, tell. And then move to that.
Okay, friends, let's start. Today, I want to share with you about something which is very important in clinical practice, and one group of remedy which is not we are going to use in our practice, especially during especially in our daily practice. So let's have. Just a minute.
ஓகே நம்ம மியூட்ல தானே வைக்கணும், மியூட்ல வைக்க கூடாதா? நம்ம இது கேட்கணும் அப்புறம்.
Close your microphone, everyone.
downloading in progress.
Okay, let's start. So, today I'm going to talk about matridonal remedies. Clinically, very important group of remedies. So, first we try to understand the general themes related to its all materia medica notes and everything. And then we try to understand the same group of remedies by one case example. So, let's start. First of all, matridonal remedies are sarcode remedies, and those remedies are derived from human tissues related to pregnancy, motherhood, and baby. So simply it's called gift of mother. So substances like amniotic fluid, placenta, and these all things used to prepare these medicines. These are the names of medicine. Amniliquor, amniotic liquid, umbilical cord, ovarian follicle, human milk with colostrum, oxytocin. So several hormones are also there. Placenta, progesterone, and waxy coating of newborn baby. It's called vernix cysiosa. So let's try to understand matridonal remedy general themes. Somebody has problem to hear my sound. So say Can I audible to you?
Yes, sir. बढ़िया आवाज आ रहा है.
Yes, sir, audible.
Okay, perfect. Okay. Because of maybe internet issue, internet or anything, you have a problem. So, but no problem. Okay. So let's try to understand general themes of this group of remedies. They have a first theme, covering and protection. So you know that baby is in a womb, right? So womb gives them covering. So while case taking, we find lot of expression that is related to covering, as we find in mollusk remedy groups or row 2 remedy group of periodic table, right? So here the person is completely enveloped anyway, or person has a habit to sleep with a blanket completely enveloped kind of covering. So or anyway during the case taking you find like person is completely need a certain kind of physical protection. It's not a protection like mother or father gives to baby. It's kind of a physical form of protection. So this desire of protection is very strong. And when there is no layer, no this kind of protection, then person feel exposed, vulnerable, bare and open. And it's life threatening for them. So here also we find conflict of being inside, because with this covering person is inside. So inside is safe, harmonious, warm, cozy, everything is there, right? But outside is dangerous. But inside you have no progress, right? You are not able to do anything better than these inside things. That's why they have a conflict of being inside and outside, as we see in mollusk remedies. So actually this entire group is very similar to mollusk remedies, but it has their own individual features also. Now, this all whatever I'm going to share the themes is not just a speculation or theory. It's on the base of materia medica, repertory, and provings, right? And this is the reason I have shared a few rubrics also. So here you see like a call of desire, glass being behind, panic attack overpowering, pride, fear. So lot of fear and panickiness is also there at one hand, and on another hand, person want to be in that covering situation. Now another theme is spacey, dreamy. So this personality is a very kind of a spacey, not grounded at all. So he might have a lot of thoughts, a kind of wavery, changeable in their talk. So multiple way we can find like person is not totally grounded at all. So it look like a spirit, like energy, like personality, because the baby is not born. So baby is in a that incarnated state, and that's why he may talk about floating, heaven, space, spirit, energy, any this kind of words he can use. Even he can talk about universe, universal energy, like that. Limitless, infinite, borderless. These are the word you can find while case taking at deeper level. High feeling, like even this kind of spaciness and dreaminess we also found in drug remedies. So that way also you feel like person feel very high, druggy, intoxicated, as if in a dream, as if I had taken alcohol and I don't able to touch the ground, as if I am floating. So there is lot of confusion, scattered, chaotic. So multiple way it also look like a Magnoliani family of plant, because they are also similarly developed. They are underdeveloped remedies, so they also have these issues. Even many times they get completely absorbed in something, whatever they are doing. So they have no sense of time and place. So they are not able to differentiate what is real, what is unreal. So multiple way you can find spaciness in these remedies. These are just examples. So you can find whenever there is a spaciness, reminiscence, it's a common theme of immature remedy. So it's not directly a theme of metadonal remedy, but you find this theme in all immature remedies. These are the rubrics. I'm not going in it. Now floating, drifting, that already we talked. Like, because if you are not grounded, then you drift, you uplift, you are in a sky, you are like a bird, you are like a floating, like a gas, like a energy, like a spirit. So multiple way person can talk. But this floating thing you will find in many remedies, especially birds, invertebrate group of remedies in animal kingdom, fishes, and water remedies also. Especially water element is so strong in these immature remedies. So they have this light feeling is very, very strong in them. This is very, very important. And this is also a mature remedies theme, not actually a metadonal theme, but these themes you find very, very prominent in these remedies. That's why I try to show you these themes earlier. Then we will discuss the specific theme that only you found in metadonal group of remedies. So here the theme is oversensitiveness and overreactiveness. They are extremely sensitive. And you imagine a baby in a womb. What is the situation? Extremely sensitive, right? Even an infant is also extremely sensitive. A slight change in food intake, slight change in environment, and baby have a lot of problem. Even a baby who are in a womb, if exposed out, then he will not survive. And that's why in modern medicine, they put baby in incubation tank, right? So they create a womb-like environment there and they provide that. So this is the way we can understand like how the oversensitivity is there. So multiple way you find intense sensitivity, lot of allergies, affecting everything affecting you. You are not able to resist, easily get affected for situation, for people, for emotions, everything. Even person many times speak like there is a no skin, anything comes in. So this kind of raw exposed, the personality is also very naive, immature. Trifle seems important, poor boundary. Please close your microphone, it's going to disturb the entire group. Right? They have many undefined modalities. If I eat something, I eat a milk, I have a problem. If I eat apple, I have a problem. If I eat uh, eggs, I have a problem. Fish, problem. So all these kind of things going to affect them. This is the way we recognize like person is intensely sensitive. So not only mental sensitivity, but a physical sensitivity is also there in them. So many ways going to express in cases. Person is very, very naive and innocent, get easily influenced by somebody. So somebody says this is good. So person get ready to believe that person or that thing. and then another person say something else, person get ready to do that also. So this is the way kind of thing you find in them. Easily putting trust on somebody, poor reasoning, they do not use their mind, very impulsive, instinctive, intuitive kind of personality. So this kind of thing you find in this group of remedies. Excitement, a thrill, acute senses, very trivial things going to get excite them. They amazed by light, amazed by color, hearing, taste, smell, everything. So this is the way, this is another polarity of over sensitivity. Once you get sensation, and if you are your body is extremely sensitive, then you have a ticklish sensation, right? So this ticklish thing is so strong in these remedies. Even many patients speak like a formication kind of sensation on the skin. Withdrawing, another thing. They, if the person take the stimulus and react with excitement, then it also react with withdrawal. They are not able to take the stimuli at all. So totally withdraw, oversleeping, early morning aggravation, prefer to be very calm, quiet, passive, do nothing, happen automatically, happen rhythmically, automatically. So many way person become completely withdrawn. Like a baby who need a lot of sleep. Even an infant, you can see how many hours an infant can sleep. Many hours, right? So that way also. Otherwise, person become insensitive, freeze out, not able to think, not able to recognize what is going on. Kind of a autistic state is also there. Or person prefer to build this kind of withdrawal by themselves, going in a trance-like state or meditation. So many way person goes in withdrawal state. These are the rubrics. Now immature. We already discussed. These remedies are immature remedies. So many way you can find immaturity in them. Total dependency is there. Someone is need who can give you everything, who can provide you everything. Very low self-confidence, self-worth, not able to decide anything, feeling inadequate, unable, unfit, weak will, there is no will, and delayed milestone. The development in childhood history, either in reality or in history, person has history of delayed milestone. So this is also immaturity theme. Delayed development, unable to control natural instincts, unable to control defecation, urination, look very childish, foolish, lack of personality, learning disabilities, timidity, shy. Now tell me, how many these kind of patients we have in practice? So many, right? So you can think of this immature medicine group of this medicine for this kind of patients you have. Clingy, dependent, very dependent. Because if you are immature and not able to handle your entire life on your own, then definitely you find intense dependency, right? Now, this is something very peculiar theme you find only in metadonal remedies. And that is any theme that is related to pregnancy and womb and baby. So many way person can talk, person can correlate, person can perceive, person can imagine. Any way you have a history of a person where you find a correlation with pregnancy, womb, and baby. Suppose person says I am a totally dependent, and when you ask describe this dependency, total dependency, and person straight away give example like a baby in a womb. So this is the way you have to find this all the things in these remedies. Any way to get connected with baby, delivery, breastfeeding, or either person loves so much of babies, especially animal babies also, or either person has intense desire to become pregnant, dream or imagination of pregnancy and baby, or either person gives whatever entire history you find the all example from childhood only. So this is where also you find correlation with pregnancy and baby. Or either person say like I was missing my those days when I was very small. I want to become a baby again. I want to go back to womb again. So these are the rubrics you find. Now, another two factors you also find in these remedies. We call them pregnancy trauma and birth trauma. So pregnancy, while a mother is in a pregnancy stage, at that time, if she has certain kind of issues that transform in a baby to develop the maternal state. So there is an intense sadness or grief during pregnancy, intense emotional trauma, intense morning sickness, complete loss of appetite, intense threat to lose the baby, severe illness with need of heavy medication. So when there is a reality, even a lady who has the real this problem, lady is a pregnant and really have a problem, this medicine is also help, or either you find the history of a person whose mother has this all the problems, either a pediatric case or even an adult case. If you find this all pregnancy or birth trauma related anything, you can confirm. And along with that immaturity and whatever we discuss other themes, when these both the things get combined, then you can think of maternal remedy. So there are many pregnancy traumas. Then we have a traumas of birth, preterm, postterm delivery, no uterine contraction, poor contraction, taking long time in birth process, artificial contraction by medicine, cesarean section, taken oxytocin injection, medically induced birth, postpartum hemorrhage, neonatal jaundice, need of incubation, toxemia of parturition, retained placenta. So multiple birth-related traumas, if you find in a history, along with that immaturity theme, you can directly think of this group of remedies. So this is the entire group. Now we try to see how these all themes we can find in case. And that's why I have selected a small case to understand how you can find this maternal theme in cases. So case has patient's own version, person's own language. So let's see. This is a case of 8-year-old boy from Bulgaria with complaint of asthma. So ask the question, tell everything about him. Ask directly to mother and father. So mother replied, he is a very good boy. He always have smile on his face. He never create tantrums or scenes like other kids can create of his age. He is obedient. He is a lovely boy. He has bronchial asthma. This is from father. Since he was 3 years old, initially the asthmatic attack comes occasionally, but now it become regular. And he needs steroid inhaler to reduce the severity of breathlessness. Apart from asthma, he is a healthy boy. He rarely has fever. Even his childhood was also good. He was the last person who gets ill in our family. So you see the person is very healthy, but from mother you find a person's quality. He's a very good boy, he has always smile on his face, and he's obedient, he's a good kid, like a lovely boy kind of thing. So this is personality quality. You require a medicine which has a phosphorus like quality in him. A very smiley, very uh, lovely kind of person. Father continue. Generally, he is emotional person, so smallest emotional issue he takes seriously. and then it turns into asthmatic attack. So even a small emotional disturbance causes the physical complaint. This is the sensitivity. First hint of sensitivity. Even he weeps easily when watching TV. He is like his mother and laugh. So a very emotional person, another quality. But you see, the smallest thing going to affect you. So hint of sensitivity is also we found here. Now mother started. Yes, he is like me. Even he also get upset if I get upset. You see, these kind of things you find in these immature remedies. Even a mother get upset, baby get upset. He like happy and humorous environment in the house. He's a very positive boy and prefer to be happy all the time. The only problem with him is he takes emotions of others very easily. He also take emotions of others. You see, there is a no border. Directly others' emotion get affect him. So ask the question, he take emotion of others. I do not understand this. And mother replied, as I said, he also get upset once I get upset. If he sees somebody begging on the street, then he become upset. If he see that teacher is scolding anybody in the class, then tears coming up in his eyes. He is a very much sensitive and get affected by any kind of emotional disturbances. So now it get confirmed like sensitive, intense sensitivity is there, but it's not a kind of a very superficial, or you can say the simple sensitivity is very intense and a kind of like directly emotion going to affect as if there is a no skin. It going inside directly. This is the reason he wants to be in happier environment. So prefer to be happy is one thing and sensitivity is another thing here. So ask the question, okay, I understand. Now, how was your pregnancy of his delivery and breastfeeding? This is the way you have to confirm in your cases. Suppose you have a idea like person is a very kind of immature or intensely sensitive, then you have to confirm it. Is it a metridonal case or not? Because invertebrates and magnolia kind of immature plant all have all the things. Even in periodic table, row 2 remedies, row 1 remedies, hydrogen, lithium, beryllium, carbon, oxygen, nitrogen. These remedies also are very immature and they also have these all the things. So mother replied, during the delivery, I was one of the happiest person in the world. We are very much excited with pregnancy because earlier I had 2 miscarriages and I was not conceived. Then after for 2 years, the pregnancy was perfectly okay. The only smaller problem I had was that I had a watery spotting now and then throughout pregnancy. So water leakage. But according to doctor, it is not affecting the fetus because his growth and other parameters are normal. So two things you see here, miscarriages, history of miscarriages, and water spotting. This is a pregnancy trauma. So this is the way you have to confirm the medicine. One more thing I want to say, doctor, I don't know why, but there are 10 days passed after the due date, but I do not have any sign of delivery. Delay delivery. This is also a sign to think of metadona. No pain, no cramps, nothing. Father, I think he do not want to come out. Father has kind of a, you can say the humorous tone. So, but this is the reality. Baby not want to come out. He is also a maternal thing. Yes, maybe. I don't know. But he was very much attached to me. Intense attachment with mother. This is also maternal quality. Because these maternal remedies are ultimately a mammal group of remedies, right? Because they bring from the mammal group of remedies, sarcodes. Even now also he wants to sleep in our room, though he is 8-year-old. Intense attachment, not able to separate from mother. This is indication of immaturity. Of course, he does not have any problem to sleep in separate room, but if we allow him to sleep with us, then he feel more happy. So ask the question, any other issues you remember about pregnancy and delivery? Nothing more, doctor. So within a few time, this link will going to get closed. So we need to move to session 2 link. As this link finish, ask the question, anything specific about his development when he was small? Nothing specific, doctor. He is a very good boy. We don't believe that he is a grown up. He is just a few inches smaller than me to father. I think within 1 year he might become adult. So this much, very high growth. This is also another thing we found here. So ask the question, any specific hobby or interest about him? He loves every kind of games. He is a lovely and easily mix up with other kids. This is the reason he has many friends. So he's a very friendlier kind of person, as like a phosphorus. Mother replied, when he was a small, he loved to take bath. Another peculiar characteristic. Whenever I made him ready to take the bath, he used to get excited. Even I know his liking. So whenever he get upset, I try to relax him by allowing him to take a bath. He prefer to stay hours in bathtub. And father replied, but he does not like sea and swimming. Mother replied, because he has fear that some nasty creature going to attack on him when he goes in sea water. So I talk with him and I confirm so I also talk with patient and I confirm his interest of bathing and love to be in water. And there is nothing more significant information obtained when I had conversation with him. So this is the history. Now we need to move to link 2 and then after we discuss what is going on for this case, right?